Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Stacy Friesland. She is the Foster Grandparent Program Manager, a program of the Land of Sky Regional Council. Welcome to our program today, Stacy.
Thank you for having me.
Of course, Stacy comes with a bachelor's in psychology from Roanoke College in Salem, Virginia. She's been the Foster Grandparent Program Manager since September 2003, and prior to working with the Land of Sky Regional Council, she was the volunteer manager at the Council on Aging in Buncombe County. She is currently a board member of the National Association of Foster Grandparents Program Directors. That's a tremendous, incredible position to be there on that national level, and want to unpack that a little bit more as we go here. Why don't you start by telling us about the program, Stacy?
Wonderful. I'd be glad to. The Foster Grandparent Program is a federally granted program under AmeriCorps Senior. It just celebrated its 55th year anniversary. So we've been around a long time. We were a War on Poverty project from President Johnson, and it just worked. There is a magic connection between an older adult and a child. And so as the years have gone by, the program has grown. Excuse me. We are really lucky to have in our area 65 foster grandparents that serve Buncombe, Madison, Henderson, and Transylvania counties. Our foster grandparents work one-on-one primarily with children that have either special needs or that may be considered at risk for a variety of reasons. And it doesn't have to be a medically diagnosed special need. It could be that they have come from a family that is struggling economically, or it may be that they're in foster care, or maybe they just have some anxiety and behavior challenges that necessitate the need of a grandparent. So our volunteers work one-on-one with these students in either an elementary school setting or a Head Start center or a nonprofit childcare center. Just really working and loving on these kids that they're assigned to. With the younger kiddos, we talk about really it's just them playing, because that's how kids learn best, through play. They're cheerleader, they're coached, they're unconditional source of love when they may not get that in other places. They do more tutoring in our elementary school setting. Some help with math. Some are really just almost like behavior coaches, just sitting with them and offering support, helping them stay focused. Our kiddos have a lot on their plates these days, and sometimes it's really a blessing for them just to have an adult that is neutral, that they can share what may be troubling them, or they can just get a hug when they need one.
I have images rolling through my mind of those magic connections happening, whether that be in playtime or, like you said, just getting a good listening ear along the way.
Absolutely.
Incredible program. And I would love for you to unpack just a little more, Stacy, on the significance of this national board that you're a part of. Like, what are you able to represent for our community because you're a part of that?
It has really been the most amazing learning experience. Before COVID, we would travel to DC once a year, sometimes twice a year, and educate our national leaders, our congressmen, about the good that our program does here locally. So I would visit our local senators or House of Representative members and tell them about the program and the good that it's doing, the funds really that the program saves. Statistically, on average, for every federal dollar that's spent, they get $5 return on that investment, which is a huge cost savings when you consider that our volunteers, each volunteer serves 1,040 hours per year. So that cost savings really adds up quickly. So we just tell them about the great things the program does. We ask for their continued support of the program because we are federally funded. We, very often come up for budget cuts annually. So we share what we do. And one of the beauties of the program is that there are these programs just like ours across the nation. And so we might look different, programs are different sizes. They're in different areas. Some are in big cities, some are in frontier land in Montana. The grandparents all serve the same community need. They're all touching those children that really need that extra support.
Creating those magic connections.
That's right. And their favorite thing, and if I get caught up in time and I don't share it, they always ask for the stories. It's the stories that really make the impact. And maybe that's because they're used to hearing numbers all day long. But these grandparents and the connection with the children they're really special. And they ask time after time for me to share a story.
Stacy, how is the grant from Pisgah Health Foundation helping you to be able to create more of those stories?
I was so excited that we received the grant funding from Pisgah Health. This grant that we did receive has allowed us to hire a part-time foster grandparent support specialist, and her job is to focus solely on recruitment. So she will be out in our outlying counties, specifically Brevard and Henderson County, some in Madison. Those are our most rural counties and our most underserved counties. So she is recruiting. Once things start to open back up, she'll be out on the ground more, making connections and trying to help us find volunteers. And then with the other part of the grant, we hope to put 5 more foster grandparents in those rural schools so that they can make those connections. We like each grandparent to serve at least 2 to 4 children that have a special need. And so by being able to place those 5 foster grandparents in those counties, we hope to be able to serve a minimum of 20 additional children that have special needs. But when you have a grandma in the classroom, and they're generally grandmas, we have all but 4 are grandmas. We have 4 men, grandpas. They're really touching all the children. They just can't not. So they really are indirectly making a difference for all the children in the classroom.
That impact is definitely spreading beyond that immediate of those that have been identified with those special needs.
Absolutely.
Stacy, what else would be important for our viewers to know about the program? How can they come alongside, get involved, and support what you're doing through the Foster Grandparent Program?
I would love, we kind of joke, and even the director of Senior Corps, or AmeriCorps Senior now, has said since she started, this is America's best kept secret, and I want to make it not a secret anymore. So I would love for people to reach out or learn more so that we are no longer a best kept secret. So that they know that the older adult in their child's classroom might be a foster grandparent, or maybe they have a grandmother or a church member who is over 55 and would qualify and be interested. We're always looking for new grandparents. It's a need that we'll never be able to fill. There's so many children in our community that need that love and connection.
Telling and sharing the stories more
Yeah.
is a huge part of what I'm hearing along the way.
Absolutely.
Stacy, on behalf of the Board of Directors at Pisgah Health Foundation, I want to thank you and the others there at Land of Sky Regional Council that are supporting this program, as well as all the grandparents who are volunteering for the tremendous work that you're doing through the Foster Grandparent Program to serve the needs of those special young ones in Western North Carolina. So thank you so very much for the work that you're doing locally and on behalf of really these children on a national level even.
Well, thank you for giving me the platform to share the wonderful work they do. They are really an incredible group of men and women.
Fantastic. Well, thank you for being part of today's Pisgah Health Today program. And we also would like to thank Wildflower Media for their creative and technical support, and to say thank you to the board of directors and staff at Pisgah Health Foundation and the Physicians Roundtable. If you would like to hear more stories like this and support other stories like you've heard today, please go to pisgahhealthinsider.org and join the movement. Until we see you on the next Pisgah Health Today, stay well and be well.